Hi friends, this is Dr. Ravi Kamapali, infectious diseases and wound care and obesity medicine specialist in Lima, Ohio, presenting you another case of wound that is a complex, that needed complex care, and a patient's perspective video attached to it. This is a nice 89-year-old gentleman with history of problems with right leg basal cell cancer that had to be given radiation treatment, and with 25 radiation treatments given in August of 2015, and the ulcer had reoccurred in January with the cancer reoccurrence that needed wider debridement of the skin cancer on the right leg, and the skin graft application was done on March 15, 2017. And the graft site did not take, and the patient did end up becoming cellulitic and had to be referred for infectious disease evaluation. If you see here, with this presentation, patient had been seen in April, and he ended up having local sloughy tissue on the ulcer bed with peri-ulcer induration, and this area that was present in the peri-ulcer region was also exquisitely tender on presentation. And we decided to debride the ulcer bed after local lidocaine gel application, and ulcer bed did also show growth of methicillin-sensitive Staph aureus, and patient was started on IV antibiotic therapy with IV rocephin 2 grams daily, and after a few days again, we did end up doing extensive local debridement with lidocaine injection, and then we did start application of wound vac, which we thought would be ideal to prepare the wound bed. And as this was done, the wound continued to improve with increasing granulation tissue, as you see here. And once this was done, by March 1st, the wound bed had remarkably improved. So by March 3rd, we then decided to apply extracellular matrix material, which is a Theraskin, which is containing a human biological skin-derived extracellular matrix that has keratinocytes, fibroblasts, and type 1, 3, and 4 collagen. And we applied it and secured it and bolstered it down with the wound vac with application of wound veil to separate the graft from the vac. And once this was done, and if you see here, the graft is nicely bolstered down, and patient ended up completing his previous antibiotic therapy, and he continued to improve. And after around 20 days, the wound vac was discontinued, and we ended up continuing the local care with application of triple antibiotic and bacitracin to the ulcer bed, to the adaptic area, and continued with compression wraps with application of Unabut to the leg. And around August 1st, we did notice that an area here had become locally erythematous and locally cellulitic because of moisture. So we had to then change the wrapping and apply ACE wraps and close compression therapy also, and close monitoring, and that improved the ulcer bed with the area, the peri-ulcer skin becoming drier, and continued close monitoring with compression therapy and also local care. And if you see, the ulcer bed had remarkably become smaller, and but given that it was a radiated ulcer bed, the healing was very slow, and it ended up by October 24th, 2017, his ulcer bed had improved, and by November 1st, 2017, he had almost completely healed. This was a follow-up on November 24, 2017. This is a case of a complex wound that remarkably went on to healing, though slowly, but definitely. And please see the patient's perspective video on the patient's take on his care. Thank you very much. We started giving you IV antibiotics, and then by May we did that graft, which is a skin substitute graft called TheraSkin, and then we started treating locally and managing it locally, and you slowly but steadily went on to heal. Yeah. And I would think by 1st of November you were almost, by last visit you were almost healed up, and this is one of the last follow-up visits.
That's
so
correct.
Tell me about your understanding as to what happened and how you felt, and through this process, what was your thinking?
Well, at first I felt uncomfortable because I had a failure there with the original skin graft was a failure, and I felt uncomfortable. But once I got with you and you explained to me what had to be done and what I needed to do faithfully every night, change my bandage like that with the wound vacs, keep it dry, no Band-Aids. I know there was no Band-Aids involved, no Band-Aids allowed. And I started feeling more and more comfortable. And then at each time when I came in here, I always looked forward to when you put the little green tag on there and took a picture of that, and it would be compared with my previous visit. I could see improvement in there.
Okay.
And I could see that. In my mind, I wanted to see how much longer, you know, and I kept hearing you say 2 weeks, 2 weeks. And finally we got to 3 weeks. We come in 3 weeks. And this time it was 4 weeks.
Yeah.
So needless to say, and I've told everybody I've come in contact with that your expertise is probably the only one in this area that I know of that I've been able to talk to and felt comfortable that something could be done and the problem corrected. Yeah. And obviously the results show it.
So basically your problem was, it was a radiated wound.
Correct.
And healing a radiated wound is very harder. And I think we achieved it with what we did was nothing but removing the barriers to healing. And the barriers for you was, number one, radiation. Of course, before that it is cancer, and then the infection. Then after that we did the skin substitute and made sure that in between we had again flare up after we, remember that?
Oh yes,
there was a flare up, and then we had to give you some oral antibiotics again, right. And then we compressed, we wrapped, and it is not just me, it's a whole process of understanding and basically God-given potential that is endowed in you, and all we did was remove those barriers to healing, and your body took care of it. I'm happy for you. Happy Thanksgiving.
Well, thank you, and I thank you for all your service and your staff. You did a great job. And to think that at one time when I looked at it, I could almost put a golf ball and it would set in there by itself. But today I can't do that. It rolls right off.
Thank you.
So thank you. I appreciate that.
Thank you very much.